the PAC is part of our Federal Affairs Department. So really, the PAC is part of advocacy at AOTA. 3 different advocacy. So it's our public affairs lobbying by OTs, OTAs, and students, as well as recipients of OT. So I'll talk more about some of that grassroots piece, which is a lot of what I think you all were also talking about. But then there's also AOTPAC, which is our Political Action Committee. And the PAC is something that's formed to help support candidates for Congress who support our issues. So I'll talk more about the PAC and the role of the PAC. But I think for you all's purposes, like all of it's important, that entire sort of advocacy piece. So I wanted to cover all of it, including some of the current environment and what's going on for home modifications.
Oh, nice.
Yeah. So because it all sort of unfolds together, and what we do at AOTA as a lobbyist, the line is very is a little less clear, because we do congressional offices with staff, which is not part of the PAC. That's part of our advocacy. But then we support candidates with money, and we go and we meet those members of Congress at those fundraising events, and that's part of the PAC. But you need both pieces to be the most effective from our standpoint. But so next slide. So I was just going to cover on the sort of who advocates at AOTA. So partly there's federal affairs, which is I'm the director of the Federal Affairs Division, and we really track all upcoming legislation to see what impact it may have on the field of occupational therapy. We can also suggest language or legislation and try to shape it. So we're not just tracking it, we're trying to influence it. And that's in everything from, we keep track of everything from Medicare, healthcare reform, education, funding, and also the kind of innovative programs that home modifications would fit into. We also are always looking for those opportunities for occupational therapy and these newer models to help people live more independently. Next slide.
Wait, Heather, now how do you know what's going? I mean, do you have lobbyists that keep track of these, or do you at AOTA keep track of them, or do you have volunteers that work with AOTA? How do you keep track of these?
So the Federal Affairs Division, there are 4 of us, and I mean, we do have like subscriptions to programs that give us keywords about what's going on the Hill, but we are the lobbyists. So that is a big part of what we do, is just trying to track. You follow committee hearings, listen who's talking about what, building relationships so that they let you know when they're going to do certain things. And yeah, so that's a big piece of what we do, like as a division. And we have tools, because everybody in Washington's trying to track legislation. So we have ways to sort of help us get some of that information into our mailbox to let us know what's going on. Sometimes if like your keyword searches don't show up the right thing, you something, but just really sort of keeping track of that environment is a big part of what we do for federal affairs.
Okay, thank you.
Yeah, sure. So next slide. And so really, as we're tracking things, a big part of our job, and I'll talk about our agenda is really guided by the AOTA board, even though the board gives us a pretty broad scope of what we're looking at. So we're promoting that federal agenda that's been approved by the board. a big piece of what we're doing is educating members of Congress and their staff about the importance of OT, and also how this OT can be part of the solution. So in the area of home modifications, and I'll give some more detail about this, we have been talking to Senate staff about OT's role in home modifications and keeping people safe at home. So that's one example of where we're educating members of Congress. We're also dealing with things like therapy cap, a new home health rule that could cut back on therapy. So we're also, why are these things bad? And the reason why occupational therapy is important is a big part of what we're always doing too. We do a lot of that work with coalition groups. Something at the end, I have some questions for you all to help in these efforts and to help me focus those efforts. I really would love your input on what we can be advocating for, what's most important to you, but also if there are any other groups that you'd recommend that we link up with in those efforts. And then we also support those grassroots activities, which are making sure that you all have the resources you need to be advocates yourself. Next slide. So I mentioned most of these, but as a big part of what we're doing with that congressional staff is educating them. We're also a resource for them, and so that's another example of where in home modifications and home falls, we're trying to position ourselves to be around those issues. We can propose legislative for those members of Congress, but then also connecting them to constituencies. So, I can serve as a link between, say, the members of Congress in your district who maybe you want to show what you do and how you can make a difference. That's a link that we can help to also create as well.
Awesome.
Next slide.
Oops.
So I want to mention that there's sort of a different division, which is also within public affairs, which some of you may have worked with them in the past, and that's our regulatory and reimbursement. So they're really looking at things after they've become law, and when those agents to decide how they're going to implement the laws and how they're going to reimburse. So they work a lot with the Center for Medicare and Medicaid, also those Medicare local contractors, which probably many of you have had a lot of interaction with, also Medicaid, private health plans, and making sure that OT services are paid for. Also looking at how the agency, so the Center for Medicare and Medicaid Services has a lot of leeway on how they implement congressional laws, and some are inclusive of occupational therapy and some are less inclusive. So that's where they're really, like, a lot of times they're going to be your frontline people. They also advocate for coding and billing policies, like what do the codes look like, what codes can we use, what is covered. So I wanted to mention them as well, because I'm sure people have, if you write into AOTPAC with questions about reimbursement, you're dealing with the regulatory reimbursement group, and they are also very interested in how can we get these kinds of services paid for, home modification services paid for. So that's just a different division. It's not me, but they're the office right next to me, so we work with them very closely.
Nice.
And next slide. So we're doing all this really in the context of a broader policy environment, and unfortunately that process is like never this sort of straight and linear. It's always sort of a long, twisted path, and so I think especially for a policy like the ones you're interested in, it takes a lot of steps, but you can kind of build a critical mass. So it may start out with, talking to a Senate office, or having someone come in and follow you and see what you're doing in a home. And it takes a little bit of time to build up that momentum, but eventually we can get to where a bill is passed or where policy is changed. But it's usually pretty complicated, as I think we've seen with healthcare policy this year. Nothing is sort of as it seems, and it's been very unpredictable. But you have to start building relationships and laying the groundwork right now. And so I'm really excited to be on this call because I would love to have that partnership and helping to build that groundwork in this area. So next slide.
Yeah, we're excited you're here, believe me.
And a big part, so it's also sort of scanning the environment, which I'm going to talk next about what environment we're working in right now, and sort of understanding the trends so we can position ourselves for when the time is right. And something I use is that you can't go paddleboarding in like 20-foot high surf, and you can't surf on a flat sea. So you kind of need to know what's going on in that environment. And so as I get into it a little bit more, I think right now there's a lot of uncertainty going on in Congress, so it's sort of not the perfect time, but I do think it's a great time to be building our base around these issues. So next slide, I think it'll be 2. Oh, so like I said, we are governed by the AOTA board, and our goals are really pretty broad, like that will expand our reach and impact, that will promote occupational therapy's distinct value to maximize health, well-being, and quality of life. But that broad goal is like square in the realm of home modifications and OT's distinct role in providing home modifications. So even if they don't say you're going to go out and like deal with the therapy cap and this home health rule, they do have this bigger vision, and it absolutely includes, OT helping to maximize being and quality of life, and trying to pass legislation or that allows us to do that. So so when I'm looking at the environment and what are the opportunities, it's within sort of this framework. And so I definitely see anything having to do with the home, but especially independence at home, is square within the strategic plan that the board has set out. And next slide. And they only have four broad goals for us, but then the next one is advancing quality and recognition of occupational therapy practice. So again, for the adoption of evidence-based prove outcomes. So I think that's also squarely in this space. So I wanted to share that I think the practice that you're doing is where we see occupational therapy moving, and where we certainly want to make sure payment policies also move in that direction as well.
And we have quite a few people in the group who are in academia that have quite a bit of research compiled on evidence-based research. So we would love to work with you on organizing that for a presentation.
And I'd love to have that shared, because we put some together, but it sounds like, and this is a false slide. I pasted that on the wrong one, so you can skip that. Okay. Yeah, I would love to have that shared.
Oh, good. Yeah, we'll work on that.
Great. And we can skip this one, sort of So, I mean, speaking of evidence, the environment that we're currently working in is that in health affairs, which everybody who does healthcare policy in DC reads health affairs, and people separate of me, staff separate of me, going in and talking about this study, we're familiar with the study, and it triggered an interest in occupational therapy and what we can do in modifying the home environment. So This and the other study that came out about in a care reducing hospital readmissions. These were like the greatest gifts that an occupational therapy lobbyist could ever be given, because they're that outside validation. So having that research and having that evidence is really an important piece, and having it in such a prominent publication as Health Affairs was really fantastic.
Awesome.
So the next slide. So I was working with a set of Senate staff on a telehealth bill, and in their telehealth bill, I made a suggestion that sort of randomly, but also in conjunction with some OTs I had spoken with, about looking at small ways to use telehealth charge from either acute care or rehabilitation facility or
Hey, Heather. Heather.
in the home. That could, yes.
You know, we just got some bad audio. Could you repeat that real quick? I don't know about everyone else, but
yeah, so
for me.
Okay. Yeah, so we were working with a Senate office on some telehealth legislation, and they had asked, do you have other suggestions for use of telehealth? And something we had put forward was the idea of having it being reimbursable home safety evaluation of someone after they have left the rehab hospital or the acute care facility as part of the continuum of care, that like a week later you could use telehealth to do that evaluation of equipment and how they were in their home. And they said, well, that may not be right for this bill, but we're writing another bill on falls, and we're looking for just sort of broader ideas. And I said, oh, if you're looking on a broader bill on falls, I'd love to come in and talk to you about OT's role in home safety evaluations and home modifications. And they were already familiar with the Capable study and did speak with those authors. But we also were able to bring in Tori Goldhammer and Mary Becker, who both have been doing home modifications, one in Howard County through their Office on Aging, and one in Washington, D.C. through their Medicaid. And so they've been doing this. Mary has some great research on the efficacy of their program. And so we were able to go in and talk to the staff about our role. And so some of the questions I have for you all at the end come directly from the questions that they immediately asked at this meeting, which relate to what would you change? What policies need changing? What are your greatest barriers? And so I would love to talk to you all some more about that piece. So that was a really great meeting. That was with Senator Brian Schatz from Hawaii and Senator Angus King from Maine. So on the next slide, so they came out with a bill, and unfortunately the bill didn't do as much I would have ideally liked, but placeholders is what I consider, that it's saying, hey, we're interested in this issue and we think that it's important. And so this bill does not do some of the broad things we suggested in our meeting, but it is asking for the Health and Human Services to start taking a look at coordinating all these different federal efforts and programs for home modifications in order to help improve those programs and expand those programs. It does require like some collection of the best evidence, collection of the results, and in order to streamline it and replicate them. So it's kind of what I call a first step bill. And they do not mention any professions or any professionals who should be carrying out these programs. It's more saying you should streamline and coordinate the existing programs, or we need to collect data on all the different programs that are out there. So that would include some of the programs that you all are involved with, but it doesn't specifically say which program. They don't pick a program, and they don't pick a profession involved. And so sometimes it's good news that there are no professions, so we're not listed, but then it can also be frustrating because that's really a huge foot in the door to have your profession listed in the bill.
Yeah.
One thing that this lets us know is that we knew that Senator Schatz and King were interested in this, but we also know that Senator Collins and Warren, who are the other two co-sponsors of the bill, that this is also something that's important to them. So that gives us offices to continue to work on those relationships too.
Nice.
Next slide. So for the congressional, and really now, is that there is this desire for better patient outcomes, a focus on chronic conditions, and an acknowledgement that home is sort of the best setting, and that we all know that's where people want to be. And sort of philosophically is that right now we're seeing cost-saving and fraud prevention measures steering away from home health and sort of that home setting. We're seeing policies coming down on the reimbursement side that don't necessarily align with this broader philosophy that everybody agrees about. Some of the innovative outcome-centered programs that had really been taking off over the last 8 years have kind of slowed down, partly because some of them don't necessarily have the results that were expected, or they were sort of really rolling out a lot of like bundled payment programs, you know, all these sort of innovation programs without having the full evidence behind them. So those have started to slow down a little bit as well. So that makes it a tougher environment for the new policies that are in. And also Congress is pretty gridlocked. So they seem they're maybe getting the essentials done, but there's not a lot of extra on top of that. But again, I see that as an opportunity when Congress is kind of gridlocked to start building your base so that when it becomes unlocked and things start to move, that then you have some opportunities. Next slide. So we do have some resources to stay up to date with what's going on. I just wanted to share. We have a news feed at TA and also our blogs. If you just sort of want to know more about what's going on in general and some of our top priorities, it doesn't reflect some of the other work we're doing behind the scenes when we're in that education part with staff, but I did want to share those resources.
So for this, if we go,
yeah.
if we're members of AOTA, we can go to this this page right here, and then click, and then just click for the news feed on one of these links. It'll give us a
Yeah, so that's on the Congressional Affairs main page. Okay. And then the other one on the right-hand side is OT Connections under AOTA blogs. We have a Federal Affairs blog.
Oh, okay.
And the blog, so you can subscribe to the blog so that you get in your email. You don't have to come to the homepage and look. And the blog sometimes has more of that behind the scenes. Hey, we had this really cool meeting with Senate staff about OT and home safety evaluations and modifications. Nice. So those are both places where you can see what we're working on. We'll go to next slide. So I did want to talk a little bit about grassroots because that's you all, and we'll go to that next slide. So, I mean, really, what I would love to be able to do is figure out the best way to help support you in any efforts and to help target, because policymakers really listen to their constituents. Like, especially as business owners and people who are doing these programs, you are in a great position to sort of do a show and tell. You're in the community, and that's what policymakers value the most. So it's that constituency on the ground first, and then that evidence is probably number two. And then what I have to say is sort of somewhere way back, unless I'm being backed up by you and the evidence as well. And so this comes from a student slide, but even students, have that sort of experience. But really, our recipients don't. In some cases, they're not able to speak for themselves. But in this case, they don't even know that this is necessarily what they need. And they don't necessarily know the difference between somebody who comes in with a checklist and says, okay, move that cord, move that throw rug, and a highly skilled occupational therapy practitioner. So, I think it's important for us to really be that advocate. Next slide.
I think that's something we all run into. Just
oh yeah, for
fuzziness.
Sure, like they don't. Look, even health systems don't seem to know the difference, right?
Exactly.
They're like, oh yeah, it's just a checklist, right? Like move the rug. Don't have a cord running from here to there. So it's something that we see a lot. And in fact, we're getting ready to comment on some falls prevention programs that are run at the federal level, just to make sure that they don't have a bias towards like, oh, did someone come in and do a checklist, a falls prevention checklist of your home environment, and then call that good enough. So there are lots of ways that we're trying to weigh in at any time any program is talking about falls or home safety or modifications. We try to get our more robust picture in there. So this is just a chart talking about who Congress really listens to, and it's that in-person visit with constituents. So we'll go to the next slide. So you can contact your members of Congress through our Legislative Action Center. You can send it right from your smartphone too. So we have messages that you can send, but then you can also write your own. So I always just want to share that AOTA.org/take action. You don't have to be in. So I think the next slide also shows how also to that same website. You can put in your zip code, and it'll show how to write to your elected officials. These are mine, but you can go to info and find out more about them. But you can also just click on email and send them a message. But through that info, if you want to call their office meeting, it gives you that contact information as well. So that's just AOTA.org/take action.
Nice.
That's a great way to find out that information. I'll go to the next slide. So there's also, it's a tips and tools page if you ever wanted to meet with your members of Congress. And I did want to point out, I know it's buried in this prepare a folder, that the two studies, the acute care reducing hospital readmissions, and part of that study found that the reason why they thought one reason why we reduced hospital readmissions is that we were focused on what people did once they got home. But also the capable study are ones that we have people as they're just going and talking about other issues that are more PCAP or our home health legislation, that when you're trying to show that evidence-based unique value of occupational therapy, Capable is one of the studies that we use to help show that and talk about unique value that we bring. But you can also, that's a good place to find those one-pagers. if you were going to go and talk. But I suspect that your issues are also, you're definitely the expert on those, but I'm not sure of our one-pagers would cover it quite as in depth as you all are able to, just by talking about your experience.
Nice.
So the next slide. So then I was going to cover the PAC real quick, and then I'm excited to have a discussion about the challenges that you face, hear about your programs, and ways that we can help support each other. So the first part of what I was talking about, that is all through AOTA's dues, through what AOTA supports me in my position. And so next, we'll go to the next slide. There's a separate connected piece, which is the AOT Political Action Committee, American Occupational Therapy Political Action Committee. And we have a board. The board directs how we spend our money. And the board is made up of people who have to be AOTA members. So there's a connection between the two, but none of the dues for AOTA members go to support the PAC. So as a nonprofit, none of the AOTA money can go to supporting candidates for office. So we have to solicit money from our membership in order to develop this PAC. And so Yvonne is our current PAC board president. As she says, the PAC really helps maintain those connections with the elected members. We attend swearing-in days, we go to inauguration events, we go to fundraisers, and we're able to support them in the work they're doing so that they in turn support us in the work that we're doing. And next slide. So PACs were established by Congress so that like-minded citizens could raise money instead of just individuals donating a specific place to help raise money. And PACs really are supposed to be around a specific issue, like support of occupational therapy. I think that the super and some of that like fuzzy money has made people very suspicious of PACs, but I will tell you, knowing the compliance, that there are contribution limits both from people to our PAC, as well as donation limits to what we can give to each member of Congress. And anyone can actually see who we give to, who we raise money from. And we also do a lobby report that shows every issue that we've gone to the Hill to talk about, and every issue that we've talked about in a fundraising event. So they also, they keep track of how much of our time is spent lobbying, either through the PAC or through AOTA. All of that is something that you can see. So I'm actually sure that our discussion with the Senate staff on home modifications is somewhere in one of our lobby reports. But as far as the PAC contributions, who we get money from and who we give to, that's all public. The next slide. Great. So I was just going to show all of our sort of friend associations also have these political action committees. And, I really think that the PAC is twofold. One, it's to give us some extra access or face time with members, so to make sure that the people who have supported us get reelected. So certainly Senator Schatz and King, Senator Collins, who's been a big supporter of our issues forever, we want to make sure that they get reelected. And this is just a sort of comparison of how we, of how much money we raise compared to some of the other associations. So APTA definitely has more members, and they raise a lot of money. Has 3 times as many members, but we're still out raising them. So, but everybody's out there, and so it is. if you don't have that avenue for meeting with people, it's tricky because other people do have that same access to get their issues in front of members. And so the next slide. So our goal for this year was 200,000, and as I left, I got the number. I think we are so far at 177,000. So we're close to hitting our 2017 goal, but we still have a little ways to go for the PAC. And next slide. So questions that I have for you all, and I'm happy to take every question that you have is what policy changes would really assist you in being better able to provide home modifications, home safety evaluations, and to do your work, whether that's from a reimbursement, having occupational therapy listed in specific programs, and then I'm also interested in who's currently participating in a government-funded, whether that's local, state, or federal home modifications program. And I should have put a third, which is what programs are you finding are you most likely able to tap into? So I know some of the areas on aging have tapped into OT, but which ones are you most? So that would all be really helpful for me as we look at ways to approach Capitol Hill on this issue. And then on a whole separate note that I forgotten to put in here is AOTA is working currently. It's a falls prevention screen tool that's used anywhere from an acute care setting to a primary care physician's office that should be administered by an occupational therapist. And then from the results of that, you'd sort of refer out. And of course, one of our referrals would be for to an occupational therapist who specializes in home modifications and sort of do that handoff. So we're looking at this continuum of falls and home safety and home modifications, and it is an issue that we're thinking about and hope to make some progress in, and I'm excited about. So I'm happy to hear people's thoughts or take people's questions, whichever you want to do first, or all at the same time.
I have a question. My name is Louie. I'm in North Carolina, and I'm also an AARP representative on the North Carolina Falls Prevention Coalition. And I'd like to know, you said something about a falls prevention screening tool that AOTA was working on. Is that a bill that's being proposed, or can you explain a little more about that?
Sure. So that's something that is still in its development phase, and it's not a bill, but actually a tool. We met with hospital administrators who were also occupational therapists, and two occupational therapists with the idea of, okay, with changing healthcare systems, while we're looking to improve overall, where can occupational therapy meet unmet needs, and what is the most needed? And their final suggestion was that falls are still not being fully addressed. And part of that, we all think, and so these are also OTs, so we're biased in its own way, that falls are still considered a issue of balance, and that people are not looking at cognition, low vision, psychosocial components, all those other pieces that can go into falls. And so it was flagged as an area that we could both show off the distinct value of occupational therapy and also make an impact on the healthcare system, if we had a successful sort of fall screening tool. So that is what that would look like. There's a group of stakeholders who got to, or experts who we got together who fleshed some of that out, and we're in the process of trying to develop it. And then the next step would be having some of those administrators who, well, the next step is having some people like stakeholders at the CDC, like a small group, take a look and see, does this seem right? And then running it better. And we're a few years out from having something complete, but that is part of our, that's something that we're working on developing right now. So sorry, that's a long answer.
Oh, no, that's great. I'm just trying to think. It sounds like it's so new that, you know, what its actual use and how it's going to be applied hasn't been determined yet. Is that true?
Correct. We're still in the development stages, but definitely want it to be something that could be used in any setting, from an ER with a person who's had repeated falls to something that was done by an OT in a community center.
Okay.
So,
thank you.
So yeah, the goal is that it could be used in any setting, but that it needs to be an OT because of the variety of expertise.
Okay. Thank you.
Sure. Stay tuned. So, I mean, I'm really curious to the group, what barriers, I guess, what are your greatest barriers to the work that you do? And what do you think would make the biggest difference? Like, what kind of changes would make the biggest difference to having more people have access to your services?
Hi, I'm Felice from Chicago, and
Hi.
I'm thinking that education in general, that a lot of the people are very reluctant to think that they need anything, that they need help, and I don't need it now, I need it later, maybe, and how they're going to pay for it. The whole thing about education, planning, and money.
Okay. Are most of the people who you work with, are they out of pocket, or is there a way that you're able to get reimbursed for your services?
No, I do it out of pocket.
Okay.
Or charge out of pocket, and so mostly they know about that before they contact me. But I see it's a problem, because a lot of people the older folks don't want to spend the money on themselves. They're like, oh, I want to save the money for my kids, or I don't need this, or you know, why should I do this? And also, I think a lot of it is also the education about the resale value of their home. I mean, I've seen some positive change. Oh, if you take your tub out and you put in a walk-in shower, that's good. But a lot of people are afraid to do that.
Yep.
Something I'd like to see done, this is Louie again in North Carolina, is some kind of legislation more or less proposing the visibility standards for, you know, homes that are, I guess, being built, whatever, that to qualify for certain, I guess, mortgages or this, that, whatever. I think more, I guess, I want to say motivation by the legislations out there that will encourage people to make the changes to their homes, that it will become more accepted to have, you know, a home that's more barrier free, and then that will also change the market such that that will help us going in to make changes in the older homes.
Right.
Did that make sense?
It does.
Okay.
It does.
But that's something that I, you know, that might be something you can talk with the legislative offices and staff about.
Sure.
Because everybody says ADA and, you know, those are the standards, but they really aren't. And
Right.
when people look at those standards, they freak out when you're a builder. And they say it'll cost too much, but the visitability standard, I think HUD, that's part of HUD's category, or, you know, purview. That's not that hard to do.
So what's that standard? Could you tell me that again?
It's a visitability standard. And basically it's like 1-0 threshold entrance of your main living area will be on the one floor. So you'll have a bath, bedroom, kitchen, laundry, and entertainment area on one floor.
Right.
And it doesn't matter if there's a whole lot of floors. And then naturally the wider doorways and halls.
Right.
So I mean, it's just 3 pretty simple things.
Right. Okay. Have any of you done work with HUD? HUD seems to be sort of the secret good partner for some of these issues, especially for working with veterans and people with disabilities. Is there anyone partnering with HUD, or the others, the areas on aging?
I haven't. But they have a lot going on to help with the hurricane victims too, from what I read. So
Okay.
they do have a lot to offer.
Hi, this is here in Maryland. Can you hear me?
Yes. Hi.
Yes, thank you for your thoughts. I just want to, talking about the challenges that we are dealing with. I know some of us have been doing this work longer than others. Myself have been in this field for the last 6 years. And I think that pioneers in the field like Karen and others have done a lot of work to share what OT stands for and what we can do and how we can impact people's life. I think the whole issue of the public understanding that OT is goes deeper than the basics that we can provide at the clinic is still sort of less understood between the public, including the medical professionals. And many of the physicians still think physical therapists will do it, and then we come next. And my concern is that as more monies, more federal monies are put into this program, when some sort of a bill becomes a law in relation to, let's say, home safety or falls prevention through CDC or HUD or any other VA program, that the physical therapy world will be at the frontier, even at this point, Medicaid, for instance, recognizes OTs to be the experts in this field. And I feel like if we can get a push in that regard, to educate the lawmakers about how well trained we are to address home safety and how we can we are the best trained people when it comes to the cognitive, sensory, visual, physical, mental issues that need to be matched with the environment that the clients live in. We will be able to be at the right moment, at the right spot to just to serve the community when any of those issues become the law. Right. So more recognition, more education of the lawmakers about OT, and hopefully that will be connected with Medicare reimbursement, and other insurances would follow suit.
Thank you. Yes, I agree. I mean, I think that you're right, that when those programs do open up, that people do sort of assume physical therapy, but it's also the same as falls. It's a big step to get from falls to home safety, right? And we know that it's not just falls, that it is broader home safety, but then also moving that to be on balance, you know, just even with the falls, moving it to be on balance to all those other things you said. I've found that we are definitely working on that every day, but it is something you have to continue to work on, because I think people are just familiar with balance, right? And maybe low vision is starting to move into one that they're recognizing too, but sort of that multi-piece is harder to grasp, and I completely agree with you on that.
And if I may ask, if you can give us some information about where you are with the telehealth bill, how far is that from coming reality? And the last thing is, I know for a fact that when Medicare started reimbursing for people on hemodialysis, what the lobbyists had to do is to take one of those monster machines on the Hill, so the lawmakers can see the agony that a patient goes through when they go through the dialysis. So I very much like your idea about having one of those maybe senators to come through and you know, see what home mods before and after can be at his place or at his mom's place.
Right. Yeah, that's something that as I was preparing for this, I thought OT can be a tough one to show. Sort of what we do, partly because some of the work is, you know, it's easier on a TV show to show PT with somebody in a walker. Or in parallel bars. But I do think with home mods, that's one that you really can do a better show and tell. So we have been talking internally about how to do more visits with members of Congress. And so that is something that we would be interested in helping to work on together. Is how to do more showing those programs that are really working. So on telehealth, there are a couple. So our idea for telehealth, like upon discharge, that did not make it into any bill, but we are on several telehealth bills where we are in several bills to help expand the use of telehealth, which would include occupational therapy. So in some cases, it's in alternative payment models, but then in other cases, it's the use of telehealth. You would just have to certify that you're not increasing the cost by using telehealth, and that would apply to services including occupational therapy, as well as telehealth under Medicare Advantage. Could also include occupational therapy. So there's been some interest in those bills. There have been hearings a lot of people have introduced. There was a whole flurry at the end of July, which made me think we might see something passed. I think that we will probably see some of the limited ones like the Medicare Advantage or the alternative payment models. I think we may see that passed in this Congress. So that's by the end of not this December, but next December. And we may even see more than that if they can be pretty sure that it's not going to increase cost. But the good news is that we're positioned in those bills so that if they expand the teleservices, it should include occupational therapy. Like we won't have to get added later. So yeah.
And if there's any way that we can lend you support when you go out in your adventures to talk to the lawmakers. I am myself located in Maryland, so I'll be happy to lend you any assistance. I'm familiar with the lobbying process. I was at Senator Cardin's office about a month ago for no reason. So
great.
I know it's tough to work with those guys, but I'll be happy to help in any way.
Wonderful. And well, it's not tough to work with Senator Cardin, but everybody
No,
else,
he's really an awesome guy. Yes, he's very friendly.
Yeah. And what was your name again?
It's Mahir. I'm gonna type it for you, and okay. With my email.
Okay.
And Heather, this is Karen from Functional Homes. I'm in Michigan, and I've got two businesses. One is an accessible construction business. I'm a licensed builder, and I've got several builders who do the construction for me. And the other is barrier-free occupational therapy, where we do the home evaluations. And I work predominantly with historically, I've worked predominantly with auto insurance because we've got the no-fault insurance here in Michigan, and workman's comp. And I think that's done a great thing for OT in Michigan. In fact, I know it has, because you can't get a home out of Michigan through auto or workman's comp unless an occupational therapist does the the home evaluation. In fact, I've been called in because PTs have done the home evaluation. They say, no, we need an OT. So that's been a really great thing for OTs in Michigan. I've done a little bit of work with the Area Agency on, well, actually, I've done quite a bit of work with the Area Agency on Aging, but not as an occupational therapist. The case managers in Michigan for the Area Agency on Aging are the ones who decide what needs to be done at the home. The reason I'm involved is because I own a construction company, so we do the construction. We build the ramps or the grab bars or whatever they need. And that's very disappointing because I feel like the social workers, God bless them, don't have the kind of training we have. It's a whole different thing. The other agency that I do quite a bit of work with, and this has just started in the last couple of years, is Medicaid. And again, basically Medicaid waivers. And the way I got involved with that yet again was through my construction company. I was brought in as the builder, and I knew a little bit about what was going on with Medicaid in my area because we had been pulled in on a few different jobs where they wanted us as the builder to do basically the evaluation and then do a design of or a redesign of the house or the bathroom or whatever. And we did a few of those. Nothing really moved, and it just was frustrating for me because it was a builder who was making all the decisions for Medicaid about home accessibility. And again, God bless builders, but what do they know about transfers and accessibility and debilitating conditions? And so I really feel that that's one thing that we could really use some help on for Medicaid. Now in my area, I'm doing all the design work and I'm doing most of the building too. So I'm charging as the OT for the design and I'm charging as the builder to do the actual build. there's another OT who does the OT evaluations. So it works out quite well. But again, the OTs are the ones who should be working with the designs too, whether they're doing the design or whether they're just consulting on the design. So that's something
Right.
I'd really love to see. As far as HUD, I didn't know HUD did anything as far as home evaluations go and OTs. And I know in Michigan,
Sure.
they do.
So, I was going to say it depends. So they've done some limited work with veterans. They also have some,
block grants
relation to people with disability. Making sure that the homes are accessible. But also through this, it's actually the CDBG block grant, the Community Development Block Grants. They have given. So I know one of the programs in Washington D.C. Is funded. Which the DC Medicaid funds, that they've also gotten extra money through the Community Development Block Grant, which actually has a lot of complicated paperwork with it. So it's kind of a case of what you wish for, because in order to make the mods, you have to jump through like 5 times as many hoops. But that is a HUD program, and HUD seems to be pretty eager to help people age in place.
Do they record? I'm sorry. Go ahead.
No.
Are occupational therapists specified as the people doing the? I mean, who's doing the recommendations? Is it builders? Is it OTs? Is it PT?
I think it just depends on the program and the grant that was provided. So in the case of the DC Medicaid program, it's specified that it's OTs.
Yay.
And I think New York City Medicaid also just implemented a program, and I'm pretty sure it has to be OTs for them as well. So there are some very specific programs that local Medicaid or that state Medicaid did write OT into it. So those two I know for sure. In the Howard County, Maryland, that's through the local area on aging, that's sort of a program that she's developed and nurtured. It won a National Blue Ribbon Award a couple of years ago, but as new bosses come in, I think they have to continue to fight for its existence. But so that is OTs who are doing those evals and modification recommendations as well. So that's a county level one. And they got some good evidence out of that, showing a reduction in referrals for home health aides.
Nice. The other thing I see here in Michigan is for the VA, they get HISA grants for like $63,000 or something like that. And there's a few other grants. But again, there's no money whatsoever for evaluations. So a lot of times, again, it's the builder who's just deciding what the design and what needs to be done is. So that's another place where I just feel like OT could use a little more help. And again, or a voice as far as the VA goes. And, it's really sad to see some of these home modifications that are completely inappropriate and the money's already spent.
Right. I think that's something that Mary out of Howard County made the point that a lot of times, like if you just have a blanket home mod, you're spending a lot more money than you necessarily need to help the person be functional in their home. Right. That it doesn't have to be big, huge structural things, that sometimes it can be pretty simple things that do the trick as well. Or you do the big structural thing and that wasn't the person's key issue anyway. Like that didn't tie into what was most important to them.
Yeah, so if there's anything we can do for, just to promote OT for HUD, VA, area agency and aging, Medicaid, like you said, it seems to start to be getting on the, on the right page. And then the other thing that go ahead.
We do have a good relationship with the federal aging but it really, it's like for each person who you've sold one person, right? So it's really getting that critical mass where everybody knows and everybody thinks of OT first.
Right.
That's one person at a time, right?
No, I don't want it to be one person at a time. I want it to be a policy for OT. Let's do one policy at a time instead.
Yes.
The other thing that our group was talking about was they're doing, we've had all these hurricanes come through and now the fires, and there's obviously a lot of rebuilding going on. FEMA's involved in it amongst, house insurance, that sort of thing. What do we need to do to get written in to some of these policies, at a federal level? I mean, I know there's emergency money going in, but where things are rebuilt in such a way that it's more user friendly for the population. And instead of rebuilding an older person's home or someone with a disability's home in the way they had it before, why isn't there, it'd be nice if there was money written in there for occupational therapy to go in and, $350 for an OT to come in and help make recommendations for what needs to be done for the rebuilding. How can we get on, how can we identify those sorts of bills that are going through and educate them? This is what we're doing. This is why you need us now. Let's do it preemptively. 350 is nothing compared to what it is to remodel a home after it's been done.
Right. So in some cases, that is those policies aren't actually written into the bill; they're written into those regulations afterwards. That like how it's implemented, and so we have been trying to build those relationships with those agencies to get that written in. But I had not thought about the FEMA rebuilding. Like that would definitely take just a little bit of research to see what policy is that based on, what's Congress moving forward, like is it a blank check or are there nuances to it? And even in the process, if it doesn't happen this time, like once you go in and you start talking to people, then they start thinking about it. That's how we get the ball rolling for eventually getting the policy changed.
That would be great. Anybody over the age of 50 or with a disability automatically gets an OT home evaluation before spending their money. I could write the policy. But, if there's anything that we can do, if stuff comes up, let us know. I have 450 people on this mailing list, just home mod occupational therapists. And so, I'd be more than happy to spread the word on anything that, maybe we can mobilize people to support you. And definitely, and one thing I'm hoping this will also help do is just get some money donated to the AOTPAC. I just feel like it's so important. We all know that, we can help create the future we all need and desire.
Yeah, we definitely, for these kinds of issues, when you get your champions, they're really your champions, and so we definitely want to see them, we want to see them reelected, that's the, so yeah, I appreciate that. You can make donations to the PAC through the website. There's a section which I should have had up there under advocacy and policy. Or you can just search for PAC on the main webpage.
Okay.
Yeah. But and I appreciate the feedback from you all and that connection. The connection. It's nice to have this resource to go to, because I think it's an important issue, and it's one that continues to come up.
Yeah, and I personally would like to see some of the money. I mean, it'd be nice if insurance would reimburse more for home mods, but with this evaluation, the way they have evaluations set up right now, usually you're lucky if you get an hour for a complex eval. It'd be nicer to see it more in
Right.
public, where OTs like us with our own businesses don't have to have some big billing company behind us to deal with all the different insurances and all the different billing procedures, just where we can, as entrepreneurs, tap into this and make it something really wonderful. So I would like to see something to support OTs and business as well. And let me read some of these comments real quick. And
I've missed, if you can, I've been on my typing screen.
Yeah. So Louis asks, HUD is a big agency. Do you have any suggestions as to which department would be best to contact for a home mod program?
I do not know that off of the top of my head. There's Karen Smith at AOTA has been doing a lot of the work with HUD along the way. So that's something that I could look into. And it kind of depends on, so it's sort of what we're finding is that different branches of HUD sort of develop an interest in, but it's not sort of like one whole big, it's not been one big group. So sort of like the veterans group might be working with Karen, and then DC has a CCDB, this other grant. So it's been different parts of HUD.
Do you think it'd be a good idea to contact Karen Smith and see if she'd speak with our group about what she's doing with HUD?
I could. I'm happy to also reach out to her and talk and make sure she's still the right person.
That would be wonderful. And Sean says, I think we were separate. Thank you. Sean says, I think we were able to separate ourselves from those who say they're ADA compliant because we know what home mods are, but also because we have access to patients' physical, functional ability to perform tasks that contractors and others do not know. That can make the difference about what is needed and what is not needed. Very true. I really just think that's a really good point for occupational therapy, to decrease the builder's role in all of this. Nancy says, I'm not that knowledgeable, but maybe we need more visibility in the bundling to prevent hospitalizations, not just rehospitalizations.
Yes, that is with our healthcare system, that is one of our key issues, is that once there's an acute episode, and that's a problem. Like, I think there are a lot of people who are thinking on that prevention side. That's why we're seeing Medicaid start to pay for some of these programs. But right now, Medicare, until you get that sort of acute care episode, it's definitely a big battle. I mean, and I think when we get there, it's going to be a good space for OT. So I completely agree.
Yeah, I've actually recently connected with the Michigan lobbyist through MIOTA. And I don't know how much you do with the just the basic states, but I just feel like
so Chuck Wilmer works really closely with the states. He's our state, so that's the third. We have our state, our regulatory, and our federal. But he definitely works closely with the state. So what issues have you been working with them on?
Just talking to him about home modifications, specifically right now with auto insurance, because there's big wars in the auto insurance industry. But just staying on top of it and making sure that we're at the table.
I know Chuck supports the states with those issues, so, but also your state association. I hope they're working with you.
Yeah.
What was his last name?
Go ahead, Louis.
What's Chuck's last name?
Oh, it's Chuck Wilmarth. Wilmarth, Wilmarth. I can type that out in the chat for you too.
Okay. Thank you.
So, Heather, what can we do? I mean, what would be the most valuable thing our group could do to support what you're doing and to also promote home mods at a federal level?
So, I mean, in part, what you're doing, like your existence, you would be surprised, is actually a really big start, because we have the, OT could do that, is something for a lot of programs. It's like, no, OT would be the best person for that, but we're not necessarily already doing it. So the fact that you are doing it and that you have people who are happy with the work you do, and that we already have people in that space is a big start. I would love to see, you said that you had some of the research. I would love to have that, sort of at my fingertips. So if you can share that, that would be great. I think, sorry?
We can definitely share our research. What form do you want it?
Whatever form you got it in.
We have several researchers in the group that can give you the basic research articles. That's not an issue. One thing that we had been discussing a couple of months ago is education-based marketing, where you just educate people what's going on based on the research and how that affects the people who we serve.
Right.
So, like,
yeah, that's it. I mean, it's fantastic that you're developing that as well, because those are the kind of, so like in mental health, that's the kind of thing that we had worked to develop, is both that sort of, here's the research, and then here's what it means, like here's what that looks like. So, if you had those materials, I'd love to see them, but even just if you have like a reference list, it's all of that is good. I would love to see what you have and share what you have, and use, so that as we talk to lawmakers, those would be great resources. I mean, well, so I was trying to think also to answer your question, because I really do think that each of these issues, like if there are opportunities at the federal level and we really need to activate people to weigh in, I will tell you right away, because that sounds like you've got a great work, a really, that everybody's really plugged in and ready to advocate, which is fantastic. And then continuing to educate at that local level. I tend to see these issues sort of grow from both ends. So I would say keep up that good work.
So if we were to put together some sort of presentation, would it be a video? Mm-hmm. Would it be a PowerPoint? How long would you want it? What exactly would be the most effective?
See, I'm thinking a lot about that, because what I found is that what you might need for a congressional office with their really short attention spans is not necessarily what you would need with like the local area, like a local area on aging, right? Where you're like, they want those details. And so for some of the more local or, you know, your state agency pitches, we found that PowerPoint that like whoever's using it can go in and use is pretty helpful. That people will take that and sort of make it their own and go in and present on the issues. For us, I think having that research and then being able to tap into experts to either be on the phone or to come in with us for those offices, that really that's helpful for us. Like once we have someone who's interested, being able to call an expert is really nice. So I think it's all of the above in some ways. So but we could talk more.
Yeah, give us some thought and let us know, because that is one thing we've all been discussing.
Okay.
And Sean says, thank you so much.
I think, Heather, we can.
Go ahead.
Sorry,
thank you.
So Heather, I think, you know, we can help you. I agree with you regarding their short attention span, and we can help you with bullet points where, you know, they get the information about falls among older adults, ER visits, the cost of them moving out of their homes, the average cost of the home modifications, the impact, the long-term impact on their well-being, mental and physical well-being, and we can pull all of that from different pieces of research to show sort of like a very short case study about how this whole process helps people versus costing the economy.
That's, yeah. Yes, I think that's exactly. I think that's exactly the kind of thing that the policymakers want.
Yep.
Would you like a brochure as well to hand them? Would that be helpful?
I think that brochures are nice, but I think one pagers actually do just as well and are probably easier.
All right.
Yeah.
That include references to research?
Yes. Yeah. I think that when you're talking about the people who make the policies, like those key people, the research is important.
Okay.
Like some offices, you just go in and say something, and they're like, that sounds great. But the people who actually make the policy and legislate, they want to know the research.
No, I'm thinking that as Maher just said about a case study, that often we ask some of these legislators about their own family members.
Yep.
Let's say, okay, well, so what happens if it's your aged parent or whoever? What would you do? And if you haven't thought about it, this is what you can do to make it really, personal and something they can relate to.
Yeah, that definitely makes a difference. There are a lot of people who, the reason why they are interested is because of their own personal experience.
Well, Heather, I want to tell you thank you so much for your time here tonight. And we're going to try to get you some of the information that you need. I think that's something we can kind of easily, actually.
Yeah, let's definitely touch base so that we maximize your effort for the return. So tonight, my brain, I think, is in lots of different places, but that would be really helpful, and it's very exciting to know about your group, and and yeah, just to know that you're here, you know, like to me, it's like this big pot of experts. Like that is something that makes me very happy.
Oh, good. Nice. Yeah, and you know, again, there's enough people in this group. I mean, that we can, you know, if you need a call to action and get people calling in about certain things, we've got a lot of people we can mobilize, I would think. So definitely keep us in mind, and then we're going to have a meeting later and talk about what we can do to get you what you need. The one pager, we've got a lot of different, we've got quite a bit of research that I've seen over the past few months, especially. So, you know, we want to do anything we can to support you. Throwing some money in the pot too is also something we all need to be doing. So, thank you so much, Heather.
Thank you. I really appreciate the invitation, and it was a pleasure speaking to you all tonight.